Hi friends, today we are going to discuss about right to access for mental health care. I am Dr. Suresh Padadmat, Head of Telemedicine Center, Head of Forensic Psychiatry Unit, Professor of Psychiatry, Newmans, Bangalore. Before I start my presentation, I would like to have a disclaimer. This presentation is academic in nature only. They are not the law. They are not a substitute for professional legal opinion. If you would like to have a legal opinion, please do contact an advocate. Conflict of interest? None. See, this right to access for mental health care directly comes from Mental Health Care Act of 2017. This legislation was passed on 7th of April 2017. So, the preamble of this legislation is very, very clear. It clearly says this legislation was passed in the parliament with the aim of providing mental health care services and also to protect and promote the fulfill the rights of persons with mental illness during the provision of the services. So there are two important aims. One is to provide mental health services. Second, to protect, promote, and fulfill the rights of persons with mental illness during the provision of this care. So with this preamble, the legislation was implemented. And if you look at the whole legislation, Chapter 5, from Section 18 to 28, is the heart and soul of the legislation. So now, today we are going to discuss only the Section 18, right to access for mental health care. So what does it Section 18 talks about? Section 18 talks about every person shall have a right to access for mental health care and treatment from mental health services run or funded by the government. Please do remember here, it is every person shall. It does not mean every persons with mental illness. Apart from Section 18, from 19 to 28, it is every persons with mental illness. Section 18 is deliberately person with mental illness has been removed because every person shall have a right to access for mental health care. A person need not have mental illness to access for mental health care. If there is a family discord, he can access mental health care for counseling. So for that reason, it has been kept open. At the same time, they have tried to define what is this access to mental health care. Access to mental health care means, under this legislation, affordable cost, good quality, available in sufficient quantity, accessible geographically, without discrimination, and acceptable to person with mental illness and to their family. So this is what is right to access mental health care. It doesn't mean free of cost. It says affordable cost. Moving further, it also talks about the range of services which has to be provided. These are outpatient, inpatient, halfway home, supported accommodation, sheltered accommodation, mental health services to support the family of persons with mental illness, home, hospital, and community based rehabilitation, child and geriatric mental health services. And all these services need to be integrated with general health services and has to be provided mandatorily from community health centers upwards. So that's what is right to access for mental health care. In a nutshell, if you ask me, it is affordable cost. It should be available and it should be accessible. And these are the range of services that should be made available to any person in the community. Further, if these services are not provided, then Section 18(5)(f) talks about compensation. That means the state has to provide compensation if these services are not provided. At the same time, it also mandates the state government to provide free treatment for below poverty line, people with below poverty line and destitutes. And also, essential drug list which are released by the central government should be made available free of cost for persons with mental illness. And this is really a boon for our persons with mental illness. The reason being is many of our patients needs to be on medication for months and years. At the same time, the mental health services shall be provided with equal quality to other general health services. That means from all these years, the mental health services has been already in the back seat. Now it has to be given the equal footage similar to physical health. For example, if the ambulance is provided for physical illness like accident and different health condition, invariably the mentally ill persons were denied with ambulance. After this legislation, now the ambulance cannot be denied for persons with mental illness. It has to be given equal footage. Similarly, insurance. Health insurance was always denied for persons with mental illness. Now, after this legislation, no insurance company can deny the health insurance for persons with mental illness because just he is mentally ill. And one more important point, 1811 talks about adequate necessary budgetary provision should be done by the state. So what are that means? It had to be adequacy, priority compared to other budget, and equity considering how the family members of persons with mental illness are going through, and depending upon the progress of the state, the budget has to be provided for mental health care. However, it doesn't mandate anything, but it has been a rough guideline has been provided under the section 18. My dear friends, this Mental Health Care Act of 2017 has taken an amazing, massive rights-based approach. Now, right to access for mental health care is a justiciable right. If mental health care services are not provided at the community health center and above, that person can go to court and ask for compensation. That is the beauty of this legislation, my dear friends. So, please do read about this Mental Health Care Act and make aware of all the citizens about this right. If you like this video, please do subscribe to my channel and click the bell icon for notification. And thank you very much for your time.